A random mix of COVID cases around the bayside suburb of St Kilda have contact tracers hard at work tonight. And worryingly, some of the mystery infections are in vulnerable and homeless communities. All up, there were 24 cases recorded overnight. Just 6 were in the community while infectious. There are now 15 cases in the St Kilda cluster. And of the 246 active cases we currently have, 56 are children under 9, 55 are aged between 10 and 19. Anyone who lives, works or spends time in St Kilda is being asked to get a COVID swab as testing ramps up in the bayside hotspots. But so too have concerns about whether our system is coping with the ballooning mental health problems in this, our 6th lockdown. Here's state political reporter Richard Willingham.
Melbourne's famed Fitzroy Street has authorities worried. It's right in the heart of the inner south where 15 COVID cases have emerged without a common link.
We have accountants, we have architects, we have a sex worker, we have members of the Orthodox Jewish community, and we have a pizza guy who works in a pizza shop in Glen Ira. It is a very broad and disparate range of people.
The sex worker lives in a rooming house and a homeless person has also been infected. Services for the vulnerable, including the Salvation Army, have become exposure sites. New testing and vaccination hubs have been quickly set up in response. More cases have been linked to these public housing towers on Lygon Street, and there's concern about slowing testing rates. So much so, the government's released a new ad campaign to fight complacency.
Can you tell the difference between a runny nose and COVID?
It's not just the testing regime that's under pressure. Successive lockdowns have caused a shadow pandemic, with a wave of mental illness flooding hospitals and GPs. And it's putting pressure on doctors, their weary staff and patients.
We're seeing new people who've never had to present for mental health reasons before, in crisis, having breakdowns, suicidal.
Making matters worse, senior psychiatrists say the workforce is broken, with some staff making more money working at hotel quarantine.
If the government can allow sports stars and movie stars in here, they can find a way to get mental health skilled clinicians in here, because we do not have enough. The mental health clinicians that are on the ground are burning out and exhausted.
We see no plan on how we can build a workforce, and we see no plan about how we can provide that level of hope that people desperately need to get their lives back on track.
GPs are also reporting a spike in people presenting for the first time, and many are worried about children.
What we're seeing is an appointment book of open wounds. You see the list of names of the people that you're going to see that day and you realise that they're really struggling.
The government is spending billions of dollars to fix the mental health system. But can it be done any faster, given the dire need?
We are fast-tracking that, but there is always more to do. What we have seen is a system that was under stress and already broken further have to look at how it delivers support.
And the toll of these latest restrictions appears to be extending to the thin blue line, with some officers struggling with the burden of enforcement.
Behind every uniform there's a human being, there's a person. There's a person often that has kids at home too. It's difficult work. It can be draining and depressing work as well.
Evidence that nearly every facet of our society is doing it tough. Richard Willingham, ABC News, Melbourne.
And if you or anyone you know is struggling, please do reach out to Beyond Blue on 1300 224 636, and you can call Lifeline on 131114. With new testing and vaccination sites being set up across Melbourne, let's take a quick look at how Victoria is tracking in the vaccine rollout. The latest figures show we're now well past 4 million vaccinations, with more than 63,000 doses administered today. 27% of the eligible population in this state is now fully vaccinated.